Good day, nurses. Welcome to our review. Let us answer 20 questions. So, let's start. Question number 1. Which duties would be performed by CNA in field nursing? A. Taking telephone doctor's order. B. Administration of IV fluids. C. Taking vital signs and blood sugars reading. And letter D. All of the above. What is the answer? Letter C. Taking vital signs and blood sugars readings. Question number 2. Who developed the hierarchy of needs? A. Dorothea Orem. B. Sister Callista Roy. C. Maslow. And letter D. Nightingale. What is the answer? Letter C. Abraham Maslow. Question number 3. Patients should be monitored vital signs every 4 hours. Which of the following is an appropriate abbreviation for this order? A. Vital signs QID. B. Vital signs Q4 hours. Letter C. Vital signs QOD. And letter D. Vital signs QD times 4. What is the answer? Letter B. Vital signs Q4 hours. Number 4. A CNA is caring for bedridden patients and notice an open sore to patient's back on scapula. What should the CNA do? A. Report this finding to the nurse. B. Apply antibiotic over the open sore. C. Ask the family members. And letter D. Do nothing. What is the answer? Letter A. Report this finding to the nurse. Question number 5. Which risk factor places patients and residents at the greater risk for fall? A. Elderly patients. B. Middle age. C. Patients with tuberculosis. And letter D. Patient in a low bed position. What is the answer? Letter A. Elderly patient. Question number 6. A CNA noticed syringe on the floor in the patient's room. What is the CNA response? A. Pick up the syringe and place in the sharps container, then report it to the nurse. B. Ignore the syringe. C. Pick up the syringe and place it in the trash can. Letter D. Leave the syringe in place and report it to the housekeeping. What is the answer? Letter A. Pick up the syringe and place in the sharps container, then report it to the nurse. Question number 7. Which is considered a normal or healthy type of grief? A. Anticipatory grief. B. Complicated grief. C. Unresolved grief. And letter D. Inhibited grief. What is the answer? Letter A. Anticipatory grief. Question number 8. What are the common signs and symptoms of diabetes mellitus? A. Polyuria, polyphagia, polygon. Letter B. Polyphagia, polyuria, polydysnia. Letter C. Polyuria, polyphagia, polydipsia. Letter D. Polygon, polyphagia, polydipsia. What is the answer? Letter C. Polyuria, polyphagia, and polydipsia. Question number 9. You observe your coworker verbally abusing a patient. What should you do? A. Talk to her after work. B. Report it to charge nurse. Letter C. Report to a patient's family. And letter D. Ignore. What is the answer? Letter B. Report it to charge nurse. Number 10. To lift an object using good body mechanics, the nurse assistant should A. Bend knees, not waist. B. Hold the objects away from the body. C. Keep both legs adducted. And letter D. Any. What is the answer? Letter A. Bend knees, not waist. Number 11. Is an illness of rapid onset and short duration termed as A. Acute illness, B. Chronic illness, C. Terminal illness, and letter D. Illness. What is the correct answer? Letter A. Acute illness. Question number 12. In an illness or injury from which the persons will not likely recover, known as A. Acute illness, B. Chronic illness, C. Terminal illness, and letter D. Illness. What is the correct answer? Letter C. Terminal illness. Number 13. You are responsible for A. Completing tasks safely, B. Supervising other nursing assistant, C. Administration of medication, and letter D. Evaluating and interpret laboratory results. What is the correct answer? Letter A. Completing tasks safely. Number 14. Injuring a person's name, reputation by making false statements known as A. Abuse, B. Defamation, C. Battery, D. Negligence. What is the correct answer? Letter B. Defamation. Number 15. Unlawful restraint of or restrictions of person's freedom of movement known as A. Criminal, B. Justice, C. False imprisonment, and letter D. Fraud. What is the correct answer? Letter C. false imprisonment. Number 16. An unintentional wrong in which a person did not act in a reasonable and careful manner resulting to harm, known as A. Battery, B. Malpractice, C. Negligence, and letter D. Crime. What is the correct answer? Letter C. Negligence. Number 17. Beating, force feeding, pinching is an example of abuse. A. Emotional abuse. B. Physical abuse. C. Sexual abuse. And letter D. Financial abuse. What is the correct answer? Letter B. Physical abuse. Number 18. Living without completing a home care assignment is an example of abuse. A. Emotional. B. Neglect. Letter C. Abandonment. And letter D. Financial. What is the correct answer? Letter C. Abandonment. Question number 19. Which is this statement is an example of open-ended question? A. What was your sister like? B. Are you saying that you want to go market? C. You want coffee? D. Could you say that again? What is the correct answer? Letter A. What was your sister like? Number 20. Which part of a patient chart you will record the vital signs, intake and output of patient? A. Progress note. B. Flow sheets and graphic sheet. C. Discharge summary. And letter D. Cardex. What is the correct answer? Letter B. Flow sheets and graphic sheets. Thank you for watching. Please share, like, and subscribe. Thank you so much.